Hello and welcome. I'm so glad to have you, Dr. Rahul. Just tell the audience a little bit about yourself.
Okay. Thanks, Siddharth.
Yeah.
Thanks for inviting me. A pleasure being on this podcast. There's a lot that we know about sleep, and that's been my passion area
Yeah.
for a better part of a decade now. To get the message across, there's so much we can do,
Yeah.
essentially, to improve. I would say essentially the quality of life of our patients,
Yeah.
like we were discussing. So, hi everyone. I am Dr. Rahul Modi. I am an ENT surgeon, a ear, nose, throat surgeon by my qualifications. And then, as my specialty area, I specialize in treating patients with uh, sleep disorders, specifically a disorder called as obstructive sleep apnea. Many of you may have heard about it, but it is something which, frankly, as doctors, also we are discovering or learning about only in the past 2 decades. So there it is. So I'm a sleep
Amazing.
apnea specialist, if you may.
And while we have met for the first time today,
Right.
I realized there's a lot of overlap
Yes.
between our journeys.
Yes.
You were in KEM,
Yes.
and then you did your masters in PGI Chandigarh.
PGI Chandigarh, that's
MS
correct.
in PGI Chandigarh.
Yes.
I have a question to ask you about work-life balance when it comes to COVID, because
Sure.
during the pandemic, all of our lives kind of changed.
Yes.
So how did you manage that work-life balance
So
before and
pandemic,
after COVID?
in the sense, at least the first wave was, it was just life and life, right? There wasn't much work to do.
Right.
Our pulmonology colleagues had taken up all the load, so to
Yes.
say. And second wave was mucor. So we got to see a lot of black fungus, and
That was
we got-
terrifying.
That was terrifying, and we didn't knew what hit us till some time, and then we started to act upon. Fortunately, I would say Bombay, where I practice, Mumbai, didn't get hit as bad as the rural parts of the country.
Speaking of a disease that isn't very common and so it doesn't spring to people's mind.
Right.
Sleep apnea is like that.
Oh, I will correct you there.
Mhm.
So I would say, you've touched my favorite topic now. So essentially, sleep apnea is out there. Whatever we know about sleep apnea so far, from the Western data in a lot of emerging data out of India, it is not that uncommon. In fact, I would contest that it is almost as common as diabetes, especially if you consider mild sleep apnea, almost as common as high blood pressure. It's just that, the eyes do not see what the mind does not know, right? So we don't look for it. We do health checkups.
Right.
We test for cholesterol.
Yeah.
We test for blood sugars. We test for thyroid. There is awareness.
Yeah.
We test for vitamin deficiencies. We don't screen for sleep apnea. I don't think many healthcare packages do a simple, like a stop bank questionnaire, a simple screening questionnaire for all their patients.
Right.
And if they start doing that as part of their health package, they can screen patients and pick it up. I would say fairly regularly, at least the moderate to severe form.
Right. So we'll talk about what sleep apnea is,
Yes, right.
because a lot of people listening might have heard of it, but they might not know of it.
So, it sounds like a complicated term,
Yeah.
but it's actually very simple. So, sleep apnea is a broad term where essentially think about apnea is essentially cessation or stopping of breathing.
Right.
That's apnea.
Somebody stops breathing for a while. That is apnea.
That's apnea.
Correct.
And think of it this way. There's essentially a simpler way to describe it is sleep disordered breathing. There is disorder in breathing while sleeping. Okay. SDB is what it's a wider term which encompasses, different forms of sleep apnea. The one that is the most common one is called as obstructive sleep apnea.
Yes.
Because these individuals essentially have airway obstructions in their sleep, and people would relate to snoring, right? So, what is a common symptom of sleep apnea? Snoring.
Right.
Okay, I would say, if not 100%, at least 99% adults with sleep apnea would snore. Children's can also have sleep apnea.
Let me just
Yeah.
pause right there. You're saying that 99% of patients who have obstructive sleep apnea will have snoring.
Yes, but not the other way around.
Correct. So not everybody who snores will have sleep apnea.
Yeah,
Right.
not the other way around.
Correct.
So to tell someone has sleep apnea, technically we need to document that the breathing is getting obstructed at night.
Right.
Snoring, like we were discussing, why would a person snore?
Huh.
Like, I mean, let's talk to the basics, right? I mean, like, snoring is something that I think we all know someone in our families who snore.
Yes.
Growing-
Sabke ghar mein, there's one
snorer.
chacha ji, one
Yeah,
uncle. who
exactly.
is
So that is what I tell
Yes.
everybody is that growing up, you always identify that chacha or mama whom you're not going to share the room with
Yes.
because that mama snores.
And it's like a funny family anecdote. कि
It is-
इनके बगल में
हाँ.
नहीं सोना है.
And classically, the person is nonchalant about it.
Yeah.
He is like, that is your problem. My snoring is not my problem.
Right.
I mean, it's like, if you have trouble, change the room.
Yeah.
I can't help it because, and it's not disturbing me, so to say. And which is what we believed, right? As doctors, till recently. I mean, like, the first descriptions of sleep apnea came in the late 70s. I mean, in the scientific term, I mean, there have been papers in the past,
Right.
but it's only in the last, I would say, 30 years where we have started taking it seriously as a sign of research.
Right. In fact, so ResMed, the company, had done a research very recently, I think
Sure.
March in 2023,
Uh-huh.
where they asked, they surveyed people
Right.
to find out what is the public opinion on snoring. And I think some 58% said that snoring is a good sign. It means that the person is sleeping well.
Sleeping well. Tragedy is, and the way our medical curriculum, even now, if I may, I was, discussing with one of the professors of Baroda Medical College at a conference. Tragedy is, even today, they should actually survey the doctors first and ask all the doctors across specialities, across, I would say, homeopaths, Ayurveds, ask everyone, do a survey. I will doubt you will get a very different number there too. I mean, like, even, I mean, it has to start there, right?
Yeah.
It has to start there where they will essentially alert their patients. I mean, I always tell patients, I mean, I don't need to convince someone to get a blood test done today, even if they are asymptomatic about it.
Yeah.
Okay. Whereas if I tell someone that I think you may have sleep apnea, let's get investigated, they'll go back to their family doctor, who's perhaps not very aware about it.
Right.
He would like to chide it away. I'm not saying he will, but likelihood is something that you are not aware about, you would not explore further.
Right.
So that's the issue.
Yeah.
Snoring was never considered cool in that sense. I mean, so another example that I always think about is obesity. So obesity was never cool. Being obese was never cool, but it was a pure cosmetic thing till like what, about 30 years back?
Okay.
Say like when we were in school, we would tease like a mota, jadya.
Yeah, but it was never a medical issue.
Exactly.
It was
So
more of a...
You will go and tell to your colleague or your friend, hey, lose weight, otherwise you'll not get married. Lose weight, otherwise, to look good. Now, if you meet a friend who's gained weight, you're going to say, boss, lose weight, otherwise you will develop ABC. You will develop high blood pressure. So
your concern has changed.
Exactly.
Right.
So now if someone is snoring, and it's all about awareness.
Right.
It's all about awareness. The nature of the disease has not changed.
Right.
Obesity still was responsible for those factors 30 years back. Still was wrecking havoc.
Yeah.
But now, it has become more common.
The empathy has changed. It's
Yes.
no longer that
Yes.
you are just fat
There is-
because you're
हाँ,
eating. It's
I mean-
very different.
I mean, there is awareness regarding body shaming now,
Right.
right? So you would not shame someone.
Correct.
Similarly, if you find a friend snoring when he's traveling in the train with you,
Yes.
when you're sharing a tent with him on the hike, when you're going out,
Yes.
you need to kind of like just tap on his shoulder and say that, boss, you were snoring.
Right.
Which is the awareness, I would say, at least during my time in the US, I was actually surprised with the level of awareness patients had there. They were very aware. And I mean, one of the reasons would be my friend just told me, I'm snoring, I may have sleep apnea. I'm here to get it tested. So this was 10 years back, right? I mean, and I don't think that's happening still here, right? I mean, we need to...
Why is that? Why is the diagnosis of sleep apnea or the awareness of sleep apnea lagging in India? Like, have we missed the boat just in diagnosing it?
So, I mean, we keep on thinking about it, right? I mean, I have a few of my colleagues across the country and we are very dedicated, and we see the thing is, the way I think about it is, The best part about sleep, I'm digressing a little bit. Best part about sleep apnea is if you make the right diagnosis and you treat the patient, and we'll talk about treatment options, you get a result within week 10 days.
Yes.
It is a eureka phenomena for the patient. The patient is like, and which is what you will never get, say, treating someone who is having asymptomatic high blood pressure. Again, I'm not the expert on high blood pressure, but if you have picked up someone who's got borderline TSH levels and started him on Thyronorm, you've got borderline sugar levels, you started lifestyle changes, or put him on like a metformin or something at the initial part, and you will never get that satisfaction. Whereas sleep apnea, you treat the patient and within a week, that patient will come back with a smile on his face and he's get, Doctor Saab, life bana diya.
So much gratitude.
So that is what drives us as doctors. That is what we want, right? Pick up the right diagnosis, fix it for the patient. Like for you guys, for neurologists, it's like Parkinsonism, right? You pick up a patient with movement disorder, bad movement disorder in those rural days, I would say, and you treat as movement disorder, give the proper Syndopa and whatever the drugs that you give, and
it's close to a miracle.
It's like that guy started walking, like he's like. So now coming to the question about why, I think part of the reason is, our curriculum doesn't highlight it as a chronic disease. We read tomes and tomes about tuberculosis, bronchial asthma, diabetes mellitus, hypertension, because essentially we are researching on it for a better part of, I would say, a century and a half.
In my practice, the commonest reasons for me to do a sleep study, which happens almost once a week, I think. I do a sleep study almost once a week. And it's always subtle things.
Yes.
It's somebody who has got some memory problem, lack of attention, they are not able to focus at work, and all other reports are normal.
Yes.
They have been going around for the last 2-3 years with these complaints, and they are getting frustrated. And just a couple of questions about sleep, snoring, sleep study done, and they are on treatment, and in 1 month they are fine. It is one of the most satisfying diseases to treat.
Absolutely. And I feel it should be I hope, and that is my kind of, I would say aim in life, is to make a diagnosis easy and to make the treatment accessible. It should not feel, and essentially it will start with making awareness in your family medicine doctor, in your MD medicine doctors. Once they are comfortable in screening, in reading sleep studies, then I think that would be the game changer. That would be the game changer in treating sleep apnea. And I have, boatload of these stories where, patients are on, a lot of medications. I have seen a lady, and again, it's more complex than that, with depression issues, but mood was better, but the fatigue wouldn't go. Just wouldn't go. She slept 8 hours, the fatigue wouldn't go. 10 hours, the fatigue wouldn't go, and she's taking the pills on time. The family is concerned. 2, 3, 4, 5 years, and you're switching the medications. Mood is better, the fatigue factor. And incidentally, I treated her neighbor with sleep apnea. I ended up meeting her 1 week on CPAP, and she actually came back with her husband, and he's like, "What did you do?" What happened? And it's not unusual to sleep apnea to be lurking there. Typically, you will find this middle-aged, so to say, 50-year-old gentleman who's not a fitness freak, but who's not unhealthy in the standard metrics, but feels like a 65-year-old. And the problem there is perhaps sleep apnea also, along with other things. So, the whole message is, the way I do it, for me, I have to screen for sleep apnea. So, remember our medical college days, where in the standard history taking, we were told no history of bronchial asthma, tuberculosis, diabetes mellitus, hypertension. You can't present a case without it. Even if you're presenting anything.
Correct. People have made mnemonics of that.
You have to mention no past history. The real change will come in when we'll add sleep apnea in that.
Beautiful.
Because it is as common as that. You need to take a sleep history of the patient. Because sleep, especially if you're a neurologist, you need to take a sleep history. Especially if you're a psychiatrist, you are a pulmonologist, you're a metabolic physician, you need to take sleep history. Once that thought process comes in, just to jot it down, like we jot down the BMI of the patient, the weight of the patient. How many hours do you sleep?
Note down,
Do you feel fresh after waking up? and what are you doing about it?
So the way I see it, our challenge or our path forward is that we need to increase awareness amongst doctors.
Yes.
But we also need to go to the grassroots.
Yes.
And increase awareness amongst people.
Patients. Yes. Yes. Absolutely.
People who might not be patients.
Yes.
Say you are sleeping next to somebody who is snoring.
Yes.
You should have the awareness of asking them to get it tested.
Yes. Yes. Yes.
Because
yes.
I'm assuming that snoring and obstructive sleep apnea has a toll on relationships as well.
Oh, big time. So big part of the patients who come in, and that's a good and bad about the awareness bit, in the sense that the wife or the husband of the snorer tends to bring in the snorer. The snorer doesn't know why his time is getting wasted. He's a busy guy or a busy lady, and the snorer feels that he's fine. And I'm just here because she can't sleep. That's not my problem. So you need to treat her and not me. And I mean, I would say India is still a very forgiving country. Spouses still adjust.
Yes.
Not so much in the West. Yes. And it does affect. Imagine, so gone are the days where you will have the lady of the house, and I'm using the stereotype male here. Ladies equally have a lot of sleep apnea. It's not that they don't have. But just to give you a stereotype of the regular household, so to say, expect a lady who has a job, who's taking care of kids. She needs to wake up early in the morning, and when she comes to bed, she cannot get sleep. She's tired, and there is a motor running next to her, and the Ganpati Baja goes on only for 10 days. But this is like a never-ending thing, right? And in a city like Bombay, how many rooms do you think each person has for themselves?
Correct.
Like, I don't think many people have a 4 BHK where they can go and sleep in a different room, and I mean, and it's a psychological thing, right? You're sleeping away from your husband. You're sleeping away from your wife. You can't adjust with him. So, I mean, it's a lot of emotional toll that way.
Layers to this problem.
Yes. And I mean, we are already stretched out, right? I mean, so in many ways, living in Bombay is not stress-free for sure, right? So, I mean, yes, it does play, and secondary problems can arise. But even the person, I mean, actually, it's just about talking to the person who's suffering. Most of them will agree they don't feel fresh. Internet, for once, has helped because a lot of them would Google and come in. Sometimes it scares more than what is needed. But for sleep apnea, anything is good, right? I mean, in that sense that any word that spreads, because अभी तो अंधेरे को चिराग की जरूरत है. I mean, that we are dealing with darkness right now. Awareness is rock bottom.
Even when it comes to, say, sharing a space, one interesting thing I've noticed is it's not just an adult problem. This problem of snoring and even obstructive sleep apnea can affect children as well.
Don't get me started. So pediatric sleep apnea is something that currently, I mean, we are seeing hordes of it. It's very common in children. And by very, I mean, on an average in a day, I mean, I would see at least 5 kids with sleep apnea.
Wow.
On a daily basis.
That's a big number.
That's a big number. And snoring in children too, it is considered cute, I think, perhaps, like, so gaya. Like now we know kid has slept. Every parent is happy that the kid has slept.
Right.
And one thing again about awareness, I mean, something that gets missed, I would say, by a mile, big time. And the impact on the kid is permanent in the sense that there is enough and more research to show that if kids develop sleep apnea, which essentially will be very innocuous symptoms, will be mild snoring, frequent colds, which every kid has, right? I mean, in that sense, mouth breathing at night, bedwetting, which something the parents will never include with sleep apnea. And they will consider it to be normal till the age of whatever. Like, I have 7-8-year-olds who are still bedwetting, and you treat their sleep apnea, a lot of that settles.
And many times bedwetting is also considered purely psychological.
Yes.
The boy is stressed out, he's not feeling well.
So I have parents who come and tell me, you know what, he doesn't bedwet because I wake him up at 3 o'clock, make him go to the washroom, then he comes back to sleep. So he's not bedwetting. Oh, he's just wearing a diaper in the night. He's not wetting the bed. So I'm like, he's 5-year-old. Why do you think a diaper is required still?
Right.
And so I can understand occasional bedwetting during colds and all, but if somebody is frequently bedwetting, grinding of teeth in the night, talking in sleep talking is a big symptom. Which again, I would say these are all symptoms which may happen because of other reasons too.
Right.
A lot of them get rightly so bundled as normal, but if you have all of them happening, then you need to think further. Yeah. And these guys are having disrupted sleep. So if you have a child who's not sleeping in the night, well, how do you expect him to perform in school once he wakes up?
So it's a waterfall effect. One thing leads to another.
Absolutely. So there's a very interesting research. I mean, something that attracted me to the field of sleep apnea was an article which got published in 2014 in New England Journal of Medicine. It's called the CHAT trial. You can look it up. It's about early adenotonsillectomy to treat sleep apnea.
What happens if somebody's been breathing from their mouth for a long time?
So you don't need long time. I mean, a simple way to test the benefit or the downside of nasal breathing is just block your nose. You're going to breathe through your mouth. Short term, you're going to feel tired, exhausted, because you're spending 5 times more energy breathing through your mouth, just maintaining your oxygen levels. You're not going to feel very rested.
5 times more energy.
5 times more energy.
Just by blocking your nose.
Just by blocking your nose, breathing through your mouth, your posture is going to become like this to align.
Right.
On a day with cold, ask people with allergies, with stuffy noses, why they are irritable. They are out of energy their entire day. Okay, because they are just breathing to survive. You remember, kids will never complain. Kids adapt. Adults complain. So that's why you can pick up a nose block in an adult.
Right.
In kids, they are so busy in their world, they are so full of energy. They don't know what to describe a nose block. They can describe pain well, because that is a life kind of threatening situation.
Right.
But they will not say nose block. Even in kids, they will never come and say, a 5-year-old will not come and say, which is the most common age group that we see in nose block.
Let's talk about what happens when you don't get sleep.
Sure.
So if there is sleep deprivation, and we've all been there.
Right.
Medical students, I think everybody has gone through those 2-3 days of sleepless nights, either while preparing for an exam or during residency.
Yes.
So we know what acute sleep deprivation does.
Yes.
You are feeling irritable, you can't focus. But what does chronic sleep deprivation do?
So I think, I'm guilty of this also, especially during my college days. Even on the days that, we would get time to sleep, we would catch up on our movies.
Yes.
Now it has become even more accessible, right?
Yep.
OTTs are there to help us catch up with whenever we want. And I used to always feel, in my college days, that sleep is a criminal waste of time. Why sleep and waste your time? You need only sleep as much as you require. I feel fresh with 4 hours. Okay. I feel fresh with 5 hours.
In fact, it's something to brag.
Exactly.
I sleep only 4 hours.
Yes. And that's a problem.
Yeah.
Because, even if you see, the culture around us encourages us to be more productive. And that is the problem.
Have you read this interview? The founder of Netflix said that we are not competing with sports and movies.
Right.
We are competing with sleep.
Oh. So no. So the challenge is right now, and they're winning the war, I feel. they're winning the competition by a mile, I feel. So see, what we have realized, sleep per se, why are we talking so much about sleep today? Why not 30 years back? The doctors were not dumb that time to not pick up symptoms. Why are we talking about it right now? It's because as a society, we are moving towards being ever open, working 24/7, time zone agnostic. Okay, so many of our friends, colleagues, patients are doing shift work.
Yeah,
we are going to be the next service backup for the entire world as a nation.
Yeah.
Okay, we are doing back-end work for Europe, America. Yeah.
So much of the world as per their timelines.
Yes.
Yeah.
And we are pushing ourselves.
Yeah.
The BPO industry has come up in the last 30 years.
Yeah.
Maybe 25 years. Yeah. And when we started pushing ourselves is when we are realizing the benefit of this chronic sleep deprivation, so to say.
Yeah.
So there was, there is multiple research in this. So acute sleep deprivation, if we don't sleep for a few days, will make us irritable, will not be ourselves, we'll be not making good judgment calls. If we are in important positions like taking decisions or managing heavy machinery, We have had major industrial accidents happen because the crew slept off on the wheel, or there is some data to suggest that the Chernobyl nuclear power plant was because perhaps the workers were not well rested. A major oil spill off the coast of Alaska perhaps happened because the crew was a little overworked. And so acute sleep deprivation we all relate to. Chronic is something that gets celebrated, unfortunately, and people try to catch up on the weekends, which is again another trend which is catching up. So the chronic sleep deprivation, to answer your question, can lead to you be constantly drowsy, not being fresh. Unfortunately, it reduces your awareness that you are sleep deprived. So if you're chronically sleep deprived, you will feel that you don't need much sleep.
This is normal.
This is normal.
Right.
Being tired is normal. Because I am 40 years old now. And I don't exercise much. So that's why I'm feeling that way.
And all my friends are feeling the same way. So
exactly.
Maybe this is okay.
I mean, our corporate culture also encourages that, right?
Correct.
We encourage an employee who will give in long hours.
Yes.
More than productive hours.
Oh, you did overtime.
You need overtime, and you're going late, you're coming up, you are doing cross-continent flights, you are, hopping countries. In 7 days, you've done 3 continents, and then you're back.
You're a hustler.
You're a he-man. Yes. And you're taking that late-eye flight and all of that. But it will age you faster because you're not resting your body enough. And there is enough data to show that it will affect your metabolism. You're more prone to cardiovascular diseases. You're more prone to diabetes. You're likely to gain weight. So there was a very interesting study, I think out of Colorado. They took 36 participants, divided them into 2 halves. One half, or rather three parts. One half slept well. 1/3 of them slept well. 1/3 only got 5 hours of sleep every night. And 1/3 of them got 5 hours of sleep over the weekdays. And they were allowed to recover their sleep over the weekend. So there is this concept called sleep debt.
Yes.
So people think that they can pay off the debt on the weekend. But this is a debt not from a good bank. This is a debt from the mafia, so to say. You have to pay heavy penalties. So what they found out in their research was very interesting. So you are typically expecting an individual to sleep at least between 7 to 9 hours. So these individuals were allowed to sleep only 5 hours. So over a week, they had a 10 to 12 hour deficit. Over the weekend, they typically caught up only 3 hours of that. Okay, so instead of the standard 8 hour sleep, say, they were sleeping 5, so 3 into 5, 15. And they were able to caught up, I think, 3 to 4 hours over the weekend. So they have really not paid off the debt. And what do you think this gentleman will have on Monday morning? He'll have a Monday morning blues. Because as you know, I mean, you're a neurologist, the melatonin has still not washed out of the system, right? So he's still feeling groggy and he's blaming that's Monday morning blues. He's not slept off. And imagine, accumulating that debt over a period of weeks, months, and normalizing it. So chronic deprivation is the new pandemic, if I may say so. And I mean, I think awareness is key. There are some organizations, there are some corporates which are allowing their employees to adjust their work times as per their sleep requirements. I think Google does that. There is some awareness there. NASA has been doing that for quite some time. But I think we'll also reach there, I hope, with the awareness coming in.
The best way to convince somebody of the importance of sleep, I have found, is to ask them to sleep for 8 hours for a week. Just try it out. And see the difference. And they'll realize that they have not felt this way in a long time.
Oh, but it's difficult, right? I mean, there is so much to do. I mean, you'll need to, I feel it's the biggest luxury. Even if, you ask the guy with, the Forbes top list and the richest guys around. I mean, if you tell them which is your biggest luxury, they'll say time and sleep. So, but that's the message which has to come across nationwide. It has to, there has to be no guilt attached to that. It has to come as part of the culture. Like
saying I am going to sleep should not be
a sign of weakness.
A sign of weakness.
It should not be that I'm lazy.
Yeah.
It's like, how we discourage smoking.
Yeah.
How we discourage substance abuse, alcohol, and we discourage sleeping pills, which is also a good thing in the sense that, but we should discourage unnecessary long hours in the night, especially for kids who are preparing, right? Their exams, the corporate guys. I mean, we should discourage them.
So just like saying, sorry, I don't drink, we should be able to say, sorry, I don't stay up late.
Yes. And which is okay. I mean, okay. I mean, I think our friends will understand, but I mean, I think it should.
I'm not sure mine would actually.
No, I've started doing that. So late nights are not for me anymore. But but I mean, I was a very late night person myself. But you could see the change and the benefit. But like you said, it has to come as part of a society push.
Yeah, you shouldn't feel such a rebel.
Yes.
Trying to do that.
Yes, you should. Yes.
So if I have to bring it down to very simple to-do lists.
Yes.
Okay. If you had to advise society, 5 things that you can do to create a healthy lifestyle as far as sleep is concerned.
Sure.
Could you have a list like that?
So very simple things.
Yeah.
I mean, first thing is start understanding like how I feel sleep is a very integral part of a healthy life. Like how good nutrition and exercises are. It's as important as getting the right diet and exercise in your lifestyle.
Yeah.
Because you're not going to sleep well. That good diet that you're eating is not going to help. So first, time or schedule or pencil in at least 8 hours of sleep in your routine. And the second thing would be get a routine. Have as far as possible fixed meal times, as far as possible, which is difficult. I'm not saying it's not, but I mean, once you get it on your priority list, then I think it's doable. Yeah. Get fixed, I would say, sleep times. Yeah. Keep your bedroom only for sleeping and sex. Don't make it your home theater. Don't make it your, party den. Don't make it your kind of like, reading chamber for that matter. As far as possible, especially the bed. The bed, specifically those people who find it difficult to fall asleep, who are very sensitive to sounds, should treat the bed as we would treat temples. We only go in our temple room to pray. Right. We don't go there and listen to music. We don't go there and watch movies. We just go to pray. Right. Similarly, the bed should only be for sleeping and for sex, nothing else. Right. That gives the message to the mind that this is my resting place. Yeah. I'm not going to get excited. And I think problem is our hostel days, because we are used to doing everything from our projects to watching movies on our hostel beds, preparing for exams. And
because in the hostel room, that's the only space that you can...
That's yours.
That's yours.
That's yours.
That's home.
Yes.
So you tend to associate the bed with whatever you want to do.
Yes.
On your laptop, you're scrolling, you're writing things, you're listening to music.
Yes.
So I can understand why that happens, but we're not in the hostel anymore.
It's your comfort zone.
It's a comfort zone, but you're not in the hostel anymore.
And you're not working 18 hours a day anymore. Correct. I mean, at least for most bit. Correct. And you're not 18 anymore. So, I mean, you need to realize that. I mean, I'm not saying that for teenagers it's okay. But I mean, if there is enough space in your hostels, don't do it on the bed. I mean, like, don't study on the bed. Right. Study on the table. And I mean, as much as possible.
Yeah, because these environment cues matter.
Yes. Second thing is, third thing rather, is the most obvious, is screen exposure. Our ever-present, ever-friendly. So technically, we were designed to have a lot of dark exposure every day. Yeah. Evenings were supposed to be dark, which allows the brain to set up their own sleep rhythm or circadian rhythm as we speak, which encourages production of melatonin, which is the hormone which initiates sleep. Yeah. In the modern day, there are a lot of lights around all the time, so the brain gets confused. At least an hour, if not an hour, then at least half an hour, you should try to reduce or just avoid the screen. And it all comes with having a routine. Yeah. Like if you want to sleep at 11, ideally you should finish by your dinner by 8. By 10:30, you should say no screen time.
Right.
Or 10 o'clock, say no screen time. And develop a nighttime routine. Yeah. I give the analogy of, say, parking your car. You're driving your car the whole day at 60, 70, 80 kilometers per hour. Nobody can park a car at that speed.
Right.
You have to slow yourself down.
Right.
Even the best drivers, even the F1 drivers have to slow themselves down and pay a lot of attention and respect the parking space.
Right.
Okay. They have to park it in a proper place. You are parking your body. You can't be thinking about the meeting tomorrow morning. You can't be replying to emails on your bed. Can't be reading the Twitter feed, waiting for the match.
Right.
You have to park your body. At 80 kilometers an hour, if you try to park your body, you will just crash. So you should not crash into a bed.
Yeah.
It should be a process.
Right.
It should be a process, like, that you slow things down.
Right.
And that's a message to your brain that it's not under any kind of a threat anymore. Because we are all animals at the end of the day, right?
And it's also the terminology, right? Because we say this all the time.
Yes.
I'm crashing.
Yes.
Don't crash.
Yes.
Love
yes.
it.
Yes. Yes.
That's
so
beautiful.
you should slow it down, and that's a control, right?
Yeah.
That's I mean, if you slow it down, you will have control over your mind. If you let it run amok, you'll be lying on the bed even when you've given time for 2 hours thinking about whatever, right?
Yeah.
So don't do that.
People wonder why they can't sleep.
That's correct. If you don't have fixed sleep times.
Yeah.
So, I mean, a request to all my colleagues and friends and everybody who's out there, if you are doing the US shift, live the shift on the weekend too. Don't try to normalize your weekend as per Indian standard timings.
Yeah.
Because that breaks the routine. As far as possible, and I know it's harsh. I mean, it's difficult. You have a kid who wants to spend time with you and the weekend is all there. But as far as possible, don't try to change your schedule.
Yeah.
It's like, flying out of US every weekend then to India. You're going to have a bad jet lag every time you do that.
Yeah.
So for anybody who's doing into shift work, very important to set your entire day, even the weekends, to that.
Yeah.
And then there are certain other things that you can do. People who find it difficult to sleep, they should essentially not keep any clocks in the room.
Oh, really?
Yes. So there is actually research to this. So what happens is when you go to the bed, you're constantly focusing on the clock. 12 बज गए नींद नहीं आ रही है 1 बज गए नींद नहीं आ रही है यार कल सुबह 6 बजे उठना है फिर वापस से उठना है and you have these alarms in this Android phones actually do that a lot in my experience is that they'll have an alarm. When you set that alarm, they'll say 5 hours and 49 minutes left. So that's a message your brain कि यार आज रात को भी नींद नहीं मिलने वाली है. Right. So it's like you need to look at these subtle messages because we absorb a lot of it, right?
Because that's an anxiety-inducing
exactly.
sentence.
And the other thing is, if you're finding it difficult to sleep, don't spend more than half an hour on the bed. If you feel that you're not getting sleep, get up, get out of the bedroom, do something calming, and come back to the bed only when you're sleeping. Sleep when you're sleepy.
Right.
Don't try to make it a punishment. Okay, I will not move out of this bed. मैं देखता हूँ कैसे नींद नहीं आती है. And those things,
You're fighting your own body.
Yes. And that is what you want to leave all the fights, right?
Yeah.
Before you go to bed, you want to relax the mind. You want to tell the mind that all is calm.
Yeah.
All is well. You are not under any kind of threat. And that is how you'll rest.
So in that same line, I want to just add a point on what to avoid in order to get good sleep. Like stimulants, coffee. What is your take on that?
So, I mean, in fact, on this note, I mean, I was going through shelf through, like a supermarket. There are very little drinks available which are either not caffeinated nowadays or not calorie rich.
Right.
So you go for juices or something they all have high sugar levels.
Right.
You go for these Coke Zeros and I don't want to take names, but any of these diet drinks, so to say.
Yeah. Or energy drinks.
Energy drinks. So energy drinks, so their intention is to give energy, so to say. So it is very difficult to avoid caffeine in today's day and age. It's omnipresent, so to say. I love coffee. So, but what we know about coffee is caffeine is a big stimulant. And you should. So earlier we used to think that 6 to 8 hours is a good gap because that's coffee's half-life. As you know, half-life means that is when whichever medication or drug that you take, half of that is still available in your system.
Yeah.
So if you take a paracetamol, the half-life is around 4 to 6 hours. For caffeine, it is 6 to 8 hours. So what that means is after 12 hours too, that's the quarter life. So a quarter of caffeine intake is still there 12 hours, 10 to 12 hours down the line.
Right.
So if you've had that mug of coffee, strong coffee at say 5 in the evening, which is not late time for coffee, right?
Yeah.
How do you think you'll fall asleep at 11?
Because it's still in that half-life period.
Yes.
Right.
And still, I mean, if not in the half-life, definitely before its quarter life is over.
Right.
So I love coffee, but I at least try to target taking that coffee latest by 12 in the afternoon. That would be my recommendation. Not 3 hours before bedtime, not 6 hours before bedtime. And by coffee, I mean anything with caffeine. Any stimulant that you want to take. And the funny bit is it's not the same for everyone in that sense. I have friends who vouch that coffee does nothing for them, and I'm happy for them. But if you're actually struggling with these things, like if I have one energy drink or two of this diet soda things, I'm done. I'm not going to get sleep till like 4 in the morning. And that's not much, right? You go out for a dinner, 2 diet sodas are not a big thing over a period of couple of hours, but that is something that people should watch out for, especially if they are finding it difficult to initiate sleep. So stimulants are not good too late in the day.
What about alcohol?
Now, a lot of people tend to take a nightcap. So they like to take their one peg of whiskey or just before sleeping because they are like, this is my sleeping aid. And I like to use this to put me off to sleep. The problem with alcohol is, so we know that it essentially depresses overall the brain function. It's not a stimulant in that sense. Whatever stimulation it does, it's by, so to say, depressing the frontal lobe and freeing the mind, so to say. Again, if you go by the half-life of alcohol, it is 3 to 4 hours. So what you will get is actually you will get a very bad insomnia or breakage of sleep. So if you had, I don't know whether you have experienced this, if you take 2 or 3 pegs of alcohol close to the dinner, the alcohol will wash out of your system at around 4 in the night, and then you are wide awake at 4 in the morning, and then you are like, okay, I mean, this is not working. So you actually get what we called as rebound insomnia. It's putting you fast asleep, and then when it is washing out, you are bouncing back and waking up.
I had read about the neurotransmitters in the brain. So because alcohol acts on GABA receptors and it uses up all the GABA receptors, the brain starts producing, once alcohol gets washed out, there is a glutamate rebound. So glutamate is an excitatory neurotransmitter. And so because of that, your brain thinks that there has been too much GABA activity going on, and now it needs to recorrect itself. So to the brain, it is just resetting back to normal. But for you, now you can't sleep. Because now there are no more GABA receptors available at that time. So you need to wait for them to get reformed in order to go to sleep.
And I mean, in the sense that, all your binge nights are the riskiest nights, right? I mean, like, because you're going to have an equally strong rebound. And it's part of the reason why you have a hangover. Because you are dehydrated, you are sleep deprived, and you're having all this acidity in the stomach. You've probably not eaten well also the previous night. So, I mean, it's a big part of that headache that you get the morning after. So that's why alcohol, again, is not such a great thing to have. Ideally, there should be at least a 3 to 4 hour gap. You should be done. And that's why the French wine culture, perhaps, of taking it early in the evening and not so much, a late night binge in the night, so to say. But I mean, we don't recommend, we actively discourage patients
having alcohol at all. So I want to discuss OSA or obstructive sleep apnea from the perspective of a patient.
Sure.
Okay, so there will be people listening to this podcast and wondering, wait, do I have this?
Yes.
So what is the first thing they should do, or should they be aware of when they think about OSA?
So first is the symptoms. Actually, for the most bit, symptoms are pretty characteristic. You can't, there are questionnaires, there are free tools available online.
Okay.
A simple form of it is called as stop bang. Very, very simple mnemonic. So you have the STOP, which means that if you're snoring heroically, loud enough to disturb your partner, loud enough to be heard out of the room, then that's a red flag. If you feel tired, that's T, the next day, even after getting the good weekend sleep, like you get a good 8 hours sleep on a Saturday, but Sunday morning you still feel groggy, and that's happening often, that's a red flag. If somebody has seen you obstruct, so if you're and then you are somebody has seen you obstruct while breathing in the night, so that's the O, that's another big red flag. And P is for pressure, that if you have blood pressure issues, then again snoring or sleep apnea is known to be a cause for blood pressure.
Right.
If you're a sleep apnea patient, you are 11 times more likely to have blood pressure.
Right.
So you need to take care of that. Then comes the bang. B is for BMI, that's body mass index. And in the Western context, it's 35 kilos per meter square. That's a very heavy person. The Indian frame body structure is thinner, so the Indian data is more closer to 30 kg per meter square.
Yeah.
So, and that's not very overweight. So if you are above that, and we can share the formula for that for the viewers to decide for themselves. It is weight in meters upon height square. So
there are again tools that you can measure BMI
yes,
very easily.
Yes.
Yeah.
And then there is A is for age, bang, BA. A is for age if you're more than 50. N is for neck circumference. So if your neck circumference is more than 16 inches, meaning you have a thick neck. And G is for gender, so male. So if you're a male more than 50 who's snoring, high chances that you have sleep apnea. This is a very good tool for moderate to severe sleep apnea. However, if somebody is having disturbed sleep, more importantly, if I have a 40-year-old or 35-year-old reasonably healthy guy who's getting 8 hours of sleep, does some snoring in the night, but still not feeling fresh in the morning, for me that's a red flag.
Right.
Okay. And typically I would ask my bed partner about my snoring patterns. They would tell, and they can tell how it has changed, say in the last 5 years or so, and they can alert me and I should listen to them. And that's a red flag. So once you feel that you have sleep apnea, I think the next step is not so much, I would say, in major cities, but perhaps in smaller towns is finding the right doctor who is trained in sleep apnea. There are fortunately many specialties who get some form of training. ENT is one of them. Pulmonology is also a very important specialty.
Pulmonology is chest medicine.
Chest medicine. Yeah. So your chest doctors. Some neurologists are also interested in this. And there are certain dentists also who have taken this up.
Right.
So idea is anybody who has the idea about sleep apnea, who's trained in sleep medicine, should be a good doctor to approach. Right. Typically, after assessing you clinically, which involves history taking, knowing your symptoms, and also evaluating your airway, because that is where the obstructions are happening. We typically order a sleep study for the patients, which is just a fancy term for monitoring your variables at night.
Right.
So the traditional way, I would say 10 years back, would be to bring you in the hospital, make you sleep in the hospital overnight with a bunch of wires, testing your oxygen patterns, breathing patterns, brain waves, muscle issues, everything. That is how the science has evolved in the last few decades. However, A, it's very expensive, I can tell. B, it's very cumbersome. And I think after COVID, it doesn't excite anybody to sleep in the hospital. Anyways, nobody's excited in sleeping in the lab. And you want natural sleep. You want people to sleep in their own comfort zone. You don't want them to sleep in a new place and find it difficult to sleep there. So there is a level 3 option, which is a very validated, it's our current workhorse for, I would say, 95% of our patients. Let your doctor decide. what he thinks is the best for you. Whether a level 3 home sleep study, where you can do a mini version of this lab sleep study at home with equal validity, reliability for the most bit, and help you decide the treatment. There are newer treatments available which are based on the pulse technology, or what we call as a PAT technology, peripheral arterial tonometry. Okay, and which is actually pretty fancy. So instead of all the gadgetry, all you have is a small ring-like thing that you have to wear in the night. Everybody is familiar with the pulse oximeter.
Yes.
After COVID. So it's somewhat similar. So it's, I would say, to simplify, and it's not that simple, but to simplify, it's an advanced pulse oximeter. So everybody's comfortable, especially people who find it sometimes difficult to sleep at night with something, in their nose or on their chest. Then it's a very good alternative. But again, please speak to your doctor. If you're not a good candidate, you don't want a false study. You don't want to miss out on sleep apnea. So that's that. Typically, we make patients sleep for 1 to 3 nights and look for patterns of obstructions. The metric that we use to measure the severity, it's called the apnea hypopnea index, AHI for short. Like how in diabetics, we look for average blood sugar at the fasting state, after meals, and the 3-month average called as the HbA1c. For sleep apnea currently, it's not perfect, but AHI is what we follow, along with other things.
The AHI indicates roughly the number of times during a night's sleep that the patient stops breathing or breathes less than what they should.
Yes, so there are 2 components to it. So typically what we look for is complete obstructions. They are the apneas, like the name, obstructive sleep apnea.
So no breathing.
So there is, so our definition is there should be cessation of breathing for at least 10 seconds or more than 90% drop. If not 100% drop, more than 90% drop in the airflow. Okay. So it's like a 10-second or 2 breaths. So if you are looking for kids, 10 seconds is too long because they have a higher breathe time. So it is 2 breaths. And hypopnea is partial obstructions. So it's a complex definition. We'll not get into it. But essentially, we look at the number of obstructions per hour of night. So if I have 40 obstructions in the night, that's 5 obstructions every hour for an 8-hour sleep. So that makes my AHI as 5. So anything below 5 is considered as acceptable. There are caveats to that, but typically less than 5 is considered normal. 5 to 15 is considered as mild. 15 to 30 is moderate, and more than 30 obstructions every hour is severe.
Which means 1 obstruction almost every 2 minutes.
Every 2 minutes, and that's like a snooze alarm every 2 minutes. So if you're going to have like 30 snooze alarm every hour, imagine waking up fresh.
That's how disturbed your sleep is.
Yes, that's correct.
And the strange thing is that there must be people out there who are getting this kind of disturbed sleep who still haven't been diagnosed.
So average guy who walks into my clinic, I don't even remember the last time I'd seen a mild guy. So average guy who walks into my clinic is like 40 per hour.
Wow.
And the sleep study also studies your oxygen profile. It's not just the obstructions. So we look at how frequently you're obstructing, how frequently you're losing oxygen, because there is a lot of oxygen fluctuations happening in sleep apnea. And imagine your heart trying to manage the oxygen supply because it is changing so rapidly. So we have oxygen levels dropping down to 40%, 50%, crazy levels. Anything below 88 is a red flag for us. And that puts the patient at an enormously high risk for heart-related events, including sudden cardiac deaths, massive heart attacks in the night. So those are our red flag features.
So if there is somebody out there who thinks they have obstructive sleep apnea, there are comorbidities.
Yes.
Things that can make the sleep apnea worse. What are those? What should they be looking
I
out
would
for?
think of it the other way around. See, if you have what we called as drug-resistant high blood pressure, if you are taking more than 1 or 2 pills for high blood pressure control, and still the blood pressure control is not satisfactory, if you are having a history of heart attacks, talk to your cardiologist. If they feel, then you should be screened for sleep apnea. If you're obese, like we discussed, if you're having high diabetes, if you're having major metabolic issues, then you should definitely get tested for this. Studies have also shown that patients who have had stroke, patients who have had major neurological conditions related to blood supply to the brain, those benefit when they screen for sleep apnea.
Yes.
Epileptics, patients with seizures, fits, if they have sleep apnea, then their seizures may get worse if you don't treat them. You know, you're a neurologist,
These two
right?
things, I have faced myself in my OPD.
Yes.
Patients who come with stroke and who don't seem to have any other obvious reason.
Yes.
And you check them for sleep apnea and they have it.
So untreated sleep apnea has, I think studies have shown up to 43% higher chance of developing strokes, cognitive decline, Alzheimer's. Untreated sleep apnea, to cut a long story short, are 3 to 4 times more likely to have a premature death.
Right.
So it's a serious condition. I have patients who have been diagnosed with sleep apnea. They were averse to get it treated because they have not heard about anybody suffering from sleep apnea.
Yeah.
So they're like, doc, we'll come back to you. They were polite in the sense that they didn't want to get treated. They just got diagnosed, and that's fine. But 2 years down the line, unfortunately, they have a severe cardiac related event. They may have had a heart attack. And then they come back to us. Doc, you had told us. Now we want to get it done. So, that should not be happen. That is what we want to avoid. Yeah. There are patients who have been diagnosed with sleep apnea and otherwise young and fit, not wanting any treatment, have met with a major car accident. I had a patient who came to me 6 months after the sleep study, and I was wondering why did she come back. She was a senior corporate honco, one of the CXOs in a big firm. And she's like, doc, I met with an accident while I was driving down Surat. You're getting all these Samruddhi expressways nowadays where people are driving, like we are getting like the Western roads, very likely for the driver to fall asleep on the wheel. And in that accident, her mother had an accident. So she's like, I blamed it on the other guy this time, but I know at the back of the mind, it was a sleep apnea which made me fall asleep on the wheel. So, it's serious stuff. Okay. So, treatment is required for sleep apnea. If you're having symptoms, get a sleep study. If you have sleep apnea, don't ignore it.
There has been so much learning here. I feel that there are so many points that were really important to get out there into the public. I hope that this conversation reaches a lot of people. I'm going to summarize just so that people understand all that we spoke about.
Sure.
We talked mainly about the problem of obstructive sleep apnea, how it is both complex, but it is also very simple, and how we should know about this, how the awareness of obstructive sleep apnea should be more widespread. We spoke about how it can be very subtle. Sometimes obstructive sleep apnea can present just as brain fog or confusion. It can even present as a low mood, or a common symptom that people come with is ghabrahat, anxiety. They don't really know why they are feeling bad, and sometimes it is because of obstructive sleep apnea. So it's a very important disease to know about, both for doctors and for the general public. The testing is so simple. You have to do a sleep study, and you have to check if are you breathing well when you are sleeping. And there are ways to do that. So ResMed is one company that you can reach out to. You can follow them. There is a free online assessment that you can take. As you explained, that there is a simple questionnaire that you can follow as a screening test.
Yes.
Which is a very useful thing for people to remember.
Yes.
And once you do have that screening done, and there's a likelihood that you have the problem, as I said, the test is simple. And once the test is conclusive, like you just explained, there are very clear treatment options that can probably save your life and completely change the way that you live. So I'm very glad that we had this conversation.
My pleasure.
Rahul, any last words, any last thoughts on this?
No, so I always tell patients, please don't ignore your symptoms.
Right.
Follow a good routine. Sleep needs to be respected as you respect your diet, as you respect your routine. And it is the easiest way to ensure a healthy life. You just need to sleep more. So just take care of that is what I would say. Don't do forced sleep deprivation, to say the least.
Beautiful.
And And if you're having symptoms like we discussed, do meet a sleep specialist, because once you sort them out, you'll be a happy man or lady.
Beautiful.
All right.
That's such an important message. And with that, we'll conclude this conversation. Thank you so much, Dr. Rahul.
Thank you.
Pleasure speaking with you.
Pleasure's all mine.
Yes. Speak to you soon.
Yes.
Bye.